Hi, I'm Dr. Brian Castelein with Brighton Foot and Ankle, and right now we're with Brian Mertz, one of our favorite physical therapists in the area. And one of the things that we always talk about in our clinic, especially with people who have pain in the front portion of their foot, plantar fasciitis, Achilles tendonitis, anything coming up and down the back portion of the leg, we are always focused on how do we lengthen those calf muscles? How do we take pressure off of either the ball of the foot or the Achilles tendon as it inserts into the heel? And a big component about that is the muscles and how those things fire and how tight and how short sometimes those muscles can be in that posterior chain. And again, this is the calf muscles, this is the hamstrings. And so we're always handing out stretching exercises. And here in the office, we've even developed our own little protocol where we have some basic stretches. And then for our people who are a little bit more active, we actually give them a 2-pager that has a front and back with a lot more stretching exercises. So Ryan, what is, like, if I send someone to you to help add length to the calf muscles, what are some of our basic stretches and some of basic activities that you can do with them?
Sure. What comes to mind initially is I've got 3 stretches that are easy for anybody to do, safe for anybody to do. One's a gastroc stretch, one's a soleus stretch, and one's a hamstring stretch. So if you don't mind, I can probably show you how we do these in the clinic. I always recommend using a wall or a countertop, something to hold on to that gives you a little bit of leverage. And the first one we're going to do is for my right gastroc. We're going to put the foot back, the knee is straight, my toes are pointed straight at the wall in front of me so that we're not toeing out, because we'll miss stretching important parts of the calf if we toe out. So we straighten those toes up, and then just keeping the knee straight, we lean forwards. And I always tell people to hold it for a minute. If we hold it for a minute, we know that we're stretching it long enough to make actual changes in the muscle length. So we hold it here, and after a minute, I'll have people move that back foot in a little bit. And then instead of having the knee straight, we'll take the knee, we'll bend it down, and we're stretching a lower muscle in our calf called our soleus at this point. So we know that in the calf there's the gastroc and the soleus. It's important to stretch both. So we would hold this one a minute as well. And then lastly, because the gastroc and soleus, they come up in the calf here and they attach into our hamstrings. And then they go down into the bottom of our foot, into our plantar fascia. What I'll have people do is just sitting on a chair, straighten that knee out, try to keep their spine straight so that you're not rounding like this. But if you tip forwards just enough to feel a good stretch in the back side of the hamstring, sometimes people will feel it in the calf. And then if you kind of pull your toes or your ankle towards your face a little bit, it'll get everything all the way from the back of your hip all the way down the back of the leg here, and even into your plantar fascia a little bit. But the big thing with this is you want to try to keep your spine straight and just feel the stretch in the leg. Again, we'd hold this for about a minute, and those are my top 3 that I would give people in the clinic to give a shot with.
One thing that you kind of alluded to too, to build upon, is that gastrocnemius muscle and the soleus muscle, those 2 muscles distally come together to form that Achilles tendon. So it is important that when you're doing kind of the countertop stretch or lean that into a wall, that you do hit both of those muscles, because again, they are both a component in that Achilles tendon. And then let's say for more advanced people, maybe for someone who's looking to train for a 5K or a 10K or even step that up to a full and half marathon, what's something else that you're going to add into those exercises?
Sure. So the first 3 are still great, still easy enough to do if you're sitting at your desk or whatever. But a couple other ones would be, if anyone's ever done yoga, like kind of getting into, and my hamstrings are not loose by any stretch of the imagination, but into like a down dog position and kind of cycling your heels up and down. Again, you're still getting those gastroc and soleus, but also the hamstring at the same time. So that's an easy enough one to do, not demonstrated perfectly, but half decent.
Yeah.
Another one would be just kind of getting into a squat position and kind of shifting your weight around in a squat position here. You can kind of use your elbows to push your knees out. You can kind of lean forwards a little bit and just trying to move around and explore the motion there. And then lastly, another one would be just standing up, kind of doing a forward fold But as you're doing that forward fold, trying to pump your toes up and down so that you feel more of a intense stretch up here. With all of these, I would probably try to do like 15 or 20 on each foot and then move on to the next. It doesn't have to be like you're holding it for very long, but enough to get things woken up, get things moving, get some blood flowing, and then maybe working on those first couple static stretches that we did to begin.
One thing that we always talk about with our patients too here is the more active you are, the more you got to be doing your stretching. And so like when you talk about these NFL, these Major League Baseball, these basketball, the NBA players, these guys, mostly guys and girls, are stretching for, hours a day, right? So for a basic stretch, how long would you suggest doing that a day? And then for the advanced stretching?
Sure, so for the static stretching, I always recommend at least a minute. And I always tell people, try to do it like breakfast, lunch, and dinner. Especially if, our patients are in a lot of pain and they're trying to get out of pain as quickly as possible. I always tell people, it's like we're digging ourselves out of a hole at first. The more flexibility we get more quickly, the better things are gonna feel faster. So I usually recommend breakfast, lunch, and dinner to try to go through these things. And then for those, higher end athletes and people who are really active, they need to dedicate that time to calming their nervous system down, elongating those tissues, helping the rest in the recovery process. And sometimes that takes quite a bit of time set aside, half an hour a day to really work on these muscles and get them back to baseline before going back out and performing and training and all that stuff.
And just like you guys stay dedicated to your training and activity routines, it's also important to stay dedicated to those recovery and taking time for your body too. So thank you, Ryan.
Yeah, you're welcome.